Did you know that nearly 1 in 3 adults in the United States has prediabetes? And here's the scary part. Most of them don't even know it. Hi there, welcome back to our channel, where we provide you with valuable information to help you live a healthier life. Today, we're going to uncover 8 silent prediabetes symptoms that you must know before it's too late. If you are new here, please don't forget to like and subscribe to our channel so you can get the latest updates on preventing and fighting diabetes. Now let's jump right in. Number 8. Increased hunger. When we talk about prediabetes, we're referring to a condition where blood sugar levels are higher than normal but not high enough to be classified as type 2 diabetes. One of the telltale signs that you might be inching towards prediabetes is an increase in hunger, known medically as polyphagia. Here's what's happening. Normally, when you eat, your body turns food into glucose, which is your body's primary energy source. Insulin, a hormone made by your pancreas, helps your cells absorb this glucose. However, in prediabetes, this system doesn't work as well as it should. Your cells become less responsive to insulin, a state known as insulin resistance. As a result, despite eating, the glucose in your blood can't get into your cells as efficiently, which means your body doesn't receive the energy it needs. It's like having a full gas tank but a malfunctioning engine. Your body, sensing it's not getting enough energy, responds by cranking up hunger signals, prompting you to eat more in hopes of getting that much needed energy. Research shows that this increase in appetite can often lead to weight gain, which unfortunately creates a cycle that further increases insulin resistance. A study in the American Journal of Physiology, Endocrinology and Metabolism explored this very cycle, indicating that weight gain from high caloric intake exacerbates insulin resistance, which in turn could escalate to type 2 diabetes if not managed. So, if you're constantly hungry, especially if you're eating well and still not feeling satisfied, it might be a signal to get your blood sugar levels checked. It's one of the body's subtle ways of waving a red flag that something might be amiss with your blood sugar regulation. Number 7. Unexplained weight gain. Unexplained weight gain can be particularly perplexing if you're conscientious about your diet and exercise routine. When prediabetes enters the scene, it can play a role in tipping the scales, but not in the way you'd want. Here's why. Insulin resistance is a hallmark of prediabetes. This means your body's cells don't respond effectively to insulin signals to take up glucose from your bloodstream. In response, your body may try to pump out more insulin to get your cells to respond. This high insulin level does a couple of things. It can increase fat storage, particularly in the abdomen, and it can also make you feel hungrier, as previously discussed. Moreover, when your muscles, fat, and liver cells begin resisting insulin's directives, the sugar that would usually be stored or used for energy remains in the bloodstream. Your body, sensing the energy isn't being utilized properly, may compel you to eat more, leading to a caloric surplus and ultimately weight gain. According to a study published in the Journal of Clinical Endocrinology and Metabolism, the very presence of insulin resistance can predict weight gain. Individuals with higher insulin resistance are more likely to gain weight. This connection is a critical area of focus for preventive health measures because managing weight can often reverse prediabetes and decrease the risk of developing type 2 diabetes. If you're noticing an uptick on the scale and can't attribute it to changes in your diet or exercise habits, it may be wise to discuss prediabetes with your healthcare provider. They can run a series of tests, including fasting blood sugar levels and HbA1c, to assess whether insulin resistance is playing a role in your unexplained weight gain. Number 6. Tingling or numbness. Tingling or numbness in your extremities, often referred to as neuropathy, is a warning sign that should not be ignored. Prediabetes can lead to elevated blood sugar levels, which, over time, can cause damage to the peripheral nerves, the vast communication network that transmits information between the central nervous system, the brain and spinal cord, and every other part of the body. In prediabetes, even moderately increased blood sugar levels can start to affect nerve function. The excess glucose in your bloodstream can interfere with the nerve's ability to transmit signals. It also has the potential to weaken the walls of the small blood vessels, capillaries, that supply the nerves with oxygen and nutrients. The sensations of tingling, numbness, or even pain that typically start at the tips of the toes or fingers and move upwards are often the first signs that this damage is taking place. It's like static on a telephone line, indicating a disruption in normal communication. Research, including studies published in journals like Diabetes Care, shows that the risk of peripheral neuropathy is significantly higher in people with prediabetes. The American Diabetes Association reports that up to 50% of people with diabetes may eventually develop neuropathy, but the progression can be slowed or even prevented with better blood sugar control, which is achievable with early intervention in the pre-diabetic stage. If you're noticing these symptoms, it's essential to consult a healthcare professional. They might recommend blood tests to check your blood sugar levels and an HbA1c test, which will give an average blood glucose level over the past 2 to 3 months. Early diagnosis and management of prediabetes can often reverse the symptoms and prevent the progression to type 2 diabetes, thereby safeguarding your nerve health. Number 5. Slow healing wounds. Slow healing wounds can be a red flag for several health conditions, including prediabetes. When your body is functioning normally, a small cut or scrape triggers a complex chain of events that leads to healing. However, if you have prediabetes, your body's ability to heal can be compromised. Elevated blood sugar levels can lead to poor circulation by affecting the blood vessels and reducing the efficiency of blood flow to certain areas, especially the extremities. With reduced blood flow, your wounds receive fewer immune cells, which are crucial in fighting off infection and facilitating the healing process. Moreover, high blood sugar can also impair the function of red blood cells that carry nutrients to the tissue that is in need of repair. Additionally, elevated glucose levels can limit the production and effectiveness of growth factors and hormones that are critical for healing. The immune system's response is also weakened, making it harder to combat any potential infections that could further delay the healing process. A study published in the Journal of Clinical Endocrinology and Metabolism found that individuals with impaired glucose tolerance, a hallmark of prediabetes, were more likely to have healing issues. Another concern, highlighted in research by the American Diabetes Association, is that these non-healing wounds can become chronic and lead to more severe complications like ulcers or even gangrene, particularly in the feet. If you're experiencing wounds that don't seem to heal as expected, it's essential to get them evaluated by a healthcare provider. They can assess for signs of infection or other complications and may suggest testing your blood sugar levels. Managing pre-diabetes through diet, exercise, and sometimes medication can help restore your body's ability to heal properly and prevent further complications. Number 4. Blurred vision. Blurred vision is often one of the earliest warning signs of prediabetes. When blood sugar levels are higher than normal for a prolonged period, it can lead to changes in the body's lens and eye fluids, causing the lens to swell and altering its ability to focus, which results in temporary blurring of vision. This blurring can fluctuate and correspond with varying blood sugar levels. When blood sugar is high, it pulls extra fluid into the lens of the eye, changing its shape and flexibility. This alters the eye's ability to focus light accurately, resulting in blurred vision. Conversely, as blood sugar levels are brought under control, vision typically returns to normal. However, repeated episodes of high blood sugar can eventually lead to permanent damage if left untreated. According to the American Optometric Association, fluctuations in blood sugar levels can lead to the onset of cataracts and contribute to the risk of developing glaucoma and diabetic retinopathy over time. Moreover, a study in the British Journal of Ophthalmology noted that even moderate changes in blood sugar could temporarily impair vision. It's crucial for individuals experiencing blurry vision to consult an eye care professional. They can help determine if the blurriness is due to prediabetes or another condition. If prediabetes is the culprit, managing your blood sugar levels through lifestyle adjustments or medication can help prevent the progression to type 2 diabetes and reduce the risk of developing more severe eye conditions. Regular eye examinations are also recommended to monitor the health of your eyes and vision. Number 3. Fatigue. Fatigue is a common symptom that many might dismiss as simply a result of a busy lifestyle. However, when it persists even after rest, it could be a signal from your body that something more is at play, such as prediabetes. Prediabetes occurs when blood sugar levels are higher than normal, but not yet high enough to be classified as diabetes. This condition can lead to an energy drain for several reasons. Firstly, with prediabetes, your body struggles with insulin resistance. This means your cells don't respond effectively to insulin, the hormone that helps sugar move from your bloodstream into your cells to be used for energy. When sugar can't enter cells as efficiently, your body doesn't receive the energy it needs, which can leave you feeling tired or lethargic. Additionally, high blood sugar levels can lead to inflammation and increased urination to try to clear the sugar from your body. This can disrupt your sleep patterns, either by causing you to wake up to go to the bathroom or by preventing you from falling into a deep, restful sleep. As a result, you might feel fatigued during the day, even if you believe you've had enough sleep. A study in the Journal of Clinical Sleep Medicine found that individuals with elevated blood sugar levels reported poorer quality of sleep and higher levels of daytime fatigue than those with normal blood sugar levels. Another aspect to consider is that people with prediabetes are often overweight, which in itself can contribute to feelings of tiredness. Managing prediabetes and the accompanying fatigue involves lifestyle changes. Regular physical activity can help improve insulin sensitivity, dietary adjustments can help stabilize blood sugar levels, and weight loss can reduce the strain on your body. It's essential to address these symptoms with a healthcare professional who can guide you on the appropriate measures to take, including testing for prediabetes if necessary. Remember, early intervention can help reverse prediabetes and prevent the development of type 2 diabetes. Number 2. Frequent urination. Frequent urination, or polyuria, can indeed be one of the telling signs of prediabetes or even undiagnosed diabetes. When there's excess glucose in your bloodstream, which is often the case with prediabetes, your kidneys go into overdrive to filter and absorb the sugar. If they can't keep up, the excess glucose is excreted into your urine, dragging fluids from your tissues along with it. This will make you urinate more often, which may leave you dehydrated and might have you reaching for more fluids, creating a cycle of frequent urination. This symptom shouldn't be ignored, especially if it's accompanied by other signs of high blood sugar. According to the American Diabetes Association, the average person usually has to urinate between 4 and 7 times in 24 hours, but people with diabetes or prediabetes may go a lot more. Importantly, while increased thirst and urination are common symptoms of diabetes, they are also part of the body's natural response mechanism to high blood sugar levels seen in prediabetes. The process is your body's way of trying to manage those sugar levels and prevent them from getting even higher. If you notice you're visiting the bathroom more frequently, especially at night, or you're increasingly thirsty, these are reasons to speak with a healthcare provider. They can perform a simple blood glucose test to check if prediabetes might be the cause. Early diagnosis and treatment can often reverse prediabetes and prevent it from progressing to type 2 diabetes. Changes in diet, an increase in physical activity, and sometimes medication can help manage the condition effectively. Number 1. Increased thirst. Increased thirst, also known scientifically as polydipsia, is commonly linked with prediabetes and diabetes. It occurs when there is too much sugar circulating in the bloodstream and your kidneys are working hard to filter and absorb the excess glucose. If they can't keep up, the glucose is excreted into your urine, which in turn draws out fluids from your tissues, leaving you dehydrated. This triggers the thirst response, making you feel the need to drink more fluids. The mechanism is your body's attempt to dilute the high blood sugar level and compensate for the fluid lost by urination. It's an early warning system that something is not right with your body's glucose regulation. The relationship between thirst and high blood sugar levels is well documented and is one of the classic symptoms of diabetes, often leading to a diagnosis. According to the Mayo Clinic, if you have persistently increased thirst and you're drinking more fluids but your thirst doesn't diminish, it's advisable to consult with a healthcare professional. By recognizing this symptom, along with any others such as frequent urination, you might catch prediabetes or diabetes early and start interventions that could improve your condition. Lifestyle changes such as a healthy diet and regular physical activity can often help manage or reverse prediabetes. Additionally, for some individuals, medication may be prescribed to help control blood sugar levels. It's important to take these signs seriously and get screened if you have concerns. Early detection and management are key to maintaining health and preventing potential complications associated with diabetes. And that wraps up our rundown of the 8 silent symptoms of prediabetes. Now, if any of these signs sound familiar, please don't wait. Reach out to your healthcare provider and get the necessary tests. Catching prediabetes early can be the difference between a simple lifestyle tweak and a long-term chronic illness. Thanks so much for tuning in. Found value in our video? A thumbs up would be awesome, and don't forget to smash that subscribe button plus the notification bell so you're always in the loop with our health insights. Stay vigilant and proactive about your health. Until next time, take care and keep making positive choices towards a healthier you.